Ladies and gentlemen, we hope you are having an enriching day 2 of the PAS so far. A warm welcome to all to Harmonizing Asia's pandemic preparedness efforts now, a PAS partner event anchored by Temasek Foundation. My name is Dr. Xingman Jie from Pandemic Preparedness Team of Temasek Foundation. Together with the Center for Impact Investing and Practices, we put together this session in response to the urgent need to harmonize pandemic efforts in Singapore, pandemic preparedness effort in Singapore. Nobody knows when, where, or how the next pandemic will occur. The last COVID pandemic has caused the world severe damage that we are still recovering from. To provide us with an overview of the risk and opportunity in Asia, let's welcome Professor Paul Pronick, Director of the Center for Outbreak Preparedness at Duke NUS Medical School, to give us a keynote speech on innovation and opportunity to prevent the next pandemic. Without further ado, Professor Pronick, the stage is yours.
Thanks, Manji. Great, thanks a lot. Good afternoon, everybody. Really good to be here together, and thanks to Temasek and Philanthropy Asia for inviting us to talk on this important issue. Before I was with Duke NUS here in Singapore, I was at UNICEF in Indonesia. And I think I'll start with a bit of a story. And it's about baby Inti. And I met her and her mom in North Sumatra a few years back. And Inti had a fever and a cough, and her mother brought her to the clinic and really didn't get any results in terms of a diagnosis. She was then hospitalized for many months, and still they had no diagnosis. And this was entirely preventable had what she was sick from been identified early. And for the past 25 years, I've been working as an infectious disease doctor in some pretty challenging places, rural villages in Africa, epidemic hot zones, big public hospitals in Asia. And I see this time and time again, that despite infections being the #1 cause of mortality in children, the vast majority of them go completely undiagnosed. And the reason for that is pretty simple. It's the fact that half the world's population lacks access to basic diagnostics. The technology that we use today to diagnose bacterial infections was invented in 1882, and it takes days to weeks to produce results. And there's still not really many good ways to diagnose a viral infection, particularly when you're working slightly downstream in the health system. So there's enormous challenges. And when you're a clinician managing infectious diseases, time is of the essence. Baby Inti needs the correct medicine very soon if she's going to get better. And at a population level, if you don't have access to diagnostics for your surveillance system, you really don't know what you're dealing with. And identifying outbreak threats early is extremely complicated. And nowhere are these issues around lack of diagnostic capacities more important than here in Asia. So Asia is the region of the world at greatest risk of outbreaks. We know this. And the reasons for this are its booming cities, its incredible ecosystem, also create situations where there's high population density, constant movement, and pretty serious environmental risks. I always love this picture from China. This is from January of this year, which shows that there were 9 billion domestic trips that took place in the 40 days that spanned Chinese New Year. Just think about that. That's almost equivalent to the entire world's population moving. In addition, most emerging infections, about 3/4 of them in humans, come from animals, right? And Asia is a place where humans and animals come together with a high degree of intensity. And that happens through massive agricultural farms and livestock production. It happens through wet markets, and it happens through home-based farms as well. So all these are quite serious issues. The lack of diagnostic capacity has also led to unprecedented rates of antimicrobial resistance, which is really one of the most pressing challenges of the 21st century. You see, when doctors don't know why patients are sick, they prescribe antibiotics pretty much as a precaution. And as bacteria get a little bit more resistant, they use even stronger antibiotics. And what you're left with at the end of the day is superbugs that respond to few, if any, treatment options. Now, each year, about 5 million people die from antimicrobial resistance, either directly or indirectly, and about half of those take place right here in Asia. So it's a serious issue, and it's driven partly, as I mentioned, by the overuse of antibiotics. But there are other issues that are equally important, including the existence of substandard medicines in many pharmacies, the use of antibiotics for agricultural production to make animals bigger, which is a big issue, and then, of course, inadequate modern sanitation systems, which plague so many areas in our region. Now, climate is really an accelerator of all of these issues. And it's not just about the weather, it's about how climate affects the biology of disease. When temperatures rise, mosquitoes move. When floods take place, sanitation systems break. When droughts happen, people migrate from rural areas into cities or crowded camps. This really changes the map of disease in an important way. So take the graph on the left side. That's from Nepal. Now, Nepal was pretty much dengue-free because it's a high mountainous area that mosquitoes weren't very happy in. But as a result of climate change, Aedes mosquitoes that transmit dengue went to a much higher altitude, and we're seeing waves of dengue and other mosquito-borne infections that we never saw before in populations that were not immune, so they get quite sick. Similarly, in areas of Europe and North America that were previously dengue-free, they're now seeing resurgence of cases. So it's a huge issue. We don't often talk about AMR and climate in the same sentence, but we really should. Warmer temperatures mean that bacteria multiply more and mutate more often. If you have floods, you have bacteria contaminating groundwater. If you have droughts and water scarcity, there's real issues around basic sanitation. And furthermore, if it's hot, farmers are using more antibiotics for livestock and aquaculture. So in many ways, climate both drives infection and also makes it harder to treat in the long run. So I'm often asked this question around, are we better off now than we were in 2019 when the COVID epidemic started? And I always answer that question by showing folks this. So ladies and gentlemen, I'd like to introduce you to a genetic sequencer, right? You can process 50 specimens at once, plug this into the back of your computer, and start generating data within just a couple of hours. It can tell you very accurately whether it's a bacterial or a viral infection or something completely different. If it's a bacterial infection, it can tell you if it's resistant to antibiotics. And it can tell you if something that we identified today here in Singapore is genetically linked and shares the same signature to something that was identified last week in Sumatra, for example. This is a game changer for infectious disease control and really something that's only been scaled up since SARS-CoV-2. We say this is one of the first silver linings of the COVID epidemic. And as part of the work that I do at Duke NUS at the Center for Outbreak Preparedness, we support something called the Asia Pathogen Genomics Initiative, which is responsible for scaling up genomic surveillance across 15 countries in Asia. And I'm pleased to report today that all countries in the region currently have the capacity to do homegrown genomic surveillance, which is really incredible. And the kicker is the price of sequencing a genome has come down from about $100 million in 2001 to less than $200 today. So that's the equivalent of moving from like a space shuttle to a smartphone. And genomics can be used for surveillance both at the bedside as well as in communities. Take AMR, for example. Now, we are at a serious crossroads because despite spending about $500 million a year, there hasn't been a new class of antibiotics invented in about the last 5 decades. So what we're left with as clinicians is to try to identify what resistant bacteria a patient has very early and get them onto appropriate treatment. And genomics is really the only way to do that. And in fact, for diseases like tuberculosis, in very high-income countries where getting people on the right treatment early is essential, all tuberculosis cases undergo screening and sequencing with genomics. Expanding that to other pathogens is an important part of our work for early identification of AMR. At the community level, genomics is also used for wastewater surveillance. And this is something that we did a lot during SARS-CoV-2, right? To try and know, is it an Omicron variant or a Delta variant? We would test wastewater. And what we know is that if you find a disease in wastewater, you can see it there many weeks before you start to see clinical cases. So it's a fantastic early warning system that really needs to scale up. So in addition to its importance for surveillance, genomics also is a foundational building block for other outbreak response tools. For example, rapid diagnostic tests, such as the home COVID test that everyone's familiar with, those are founded on data from genomic surveillance, right? And these are incredibly important for scaling up, at home or in low resource settings where you don't have laboratories and so forth. In addition to that, the other kind of silver lining from the COVID pandemic has been the advent of mRNA vaccines. And mRNA vaccines are essentially reverse engineered using genomic information. Even 5 years ago, just to give you a sense, making a vaccine was kind of like being a farmer. A virus had to be grown. So a farmer would plant a crop, hope for rain, pray that it's free of pests, and at the end of a long growing season, you have a vaccine available. So in a single factory, very similar to a farmer growing a crop. But with mRNA vaccines, you don't have to grow the virus. It's more like a chemical process that happens in a very small room, kind of like having a bakery, right? So you knead your batter, you let it sit overnight, and then the next day, you bake your bread. But you don't just bake bread, you bake cakes and scones and croissants and tarts, right? And you can do all that in the same small complex. So things that used to take many years, were very expensive, with high risk of contamination, can now be done much more simply. And this allows us to democratize the technology for developing new outbreak response tools in ways that are quite effective. And we're really just at the beginning of that. Now, despite all of these innovations, one of the things that we also need are strong systems to deploy them. And this is particularly important during peacetime, not when the next pandemic is upon us. And there's two major approaches that I want to kind of draw attention to here. The first is the always-on approach. And this says we need to invest in surveillance systems that build capacity for genomics today. And it's good to be here at PAA because this is something that countries can't do alone. Governments are fantastic at implementing known interventions at scale, not so good sometimes at innovation, not so good at taking new things and figuring out, what should we use genomics for in our context based on the burden of disease, et cetera, et cetera. So catalytic resources are really important, and that needs to be combined with domestic resources, which of course are critical for sustainability. So this always-on approach is quite key, and what it basically says is we need to invest in surveillance for common conditions, like AMR, like TB, like dengue, so that if we find something unusual, we can pivot that capacity to address potential outbreak threats. And we know this works because we saw it in South Africa. They were fantastic at doing sequencing for HIV and tuberculosis well before COVID struck, and they were able to pivot that capacity quite quickly to be amongst the first kind of forerunner or pioneering countries in the COVID response. The other approach I wanted to draw attention to is the 100-day mission. And what the 100-day mission tries to do is bring together innovations in surveillance with innovations in response. And the idea is that there's a 100-day window between identifying an outbreak threat and having countermeasures available, whether it's diagnostics, therapeutics, or vaccines. The final innovation that I wanted to draw attention to is something that Bill Gates talked a little bit about in his discussion with the president yesterday. And that's all about the role of AI and genomics. And just to give you, I like metaphors because it's a little complicated thing to understand, but think about a genome like a raindrop. So a single raindrop by itself doesn't mean anything. But what's important is what it says about the cloud above it. And we need to know whether that cloud is going to become a monsoon, whether it's going to hit landfall in a populated area, and what we should do about it. Now, large language models, because genetics is basically a language, allows us to read genetic information and look at it alongside other types of what we call contextual information, like climate data, population data, mobility data, health information such as vaccination coverage. And that allows us to understand genetic data better and be able to make decisions about it, whether it's clinical decisions or public health decisions or decisions as researchers or industry partners. So this is something that we work on very closely with our partners in Asia as part of the work that we do at the Asia Pathogen Genomics Initiative. And we firmly believe that this is going to be the future for kind of outbreak prevention and response. So just to kind of close where we began with baby Inti, she's counting on us. And millions of children like her want us to act on what we've learned today, on what we've learned over the past several years. The science is here, the tools are ready, and for me, there's never been more exciting time to be involved in infectious diseases. And I firmly believe we can live in a world where outbreak threats aren't things that shut down our cities and appear in our headlines. Instead, these are things that we should read about in our history books and look at behind the glass in museums and kind of sit with our children and say, this is what people used to live like, and let's not make that happen again. So just in closing, I think there's a lot that we can do, but let's prevent the next epidemic and outbreak, and let's try and stop things before they begin. So I'll stop there, and thanks very much for your attention.
Thank you, Professor Parnick, for the illuminating keynote. It's definitely sobering to hear about the risks that we are facing, but uplifting at the same time to hear about the many innovative solutions out there to help us detect the next pathogens that has potential pandemic. And this note, let us turn to the role of private, public, and philanthropic sectors in helping to harmonize pandemic preparedness efforts in our region. The coming panel discussion will be moderated by Dr. Lee Fook Kay, head of the Pandemic Preparedness team at Temasek Foundation. Let us welcome Dr. Lee on stage. May I also welcome on stage our esteemed panelist, Dr. Gina Saman, Director of the Western Pacific at the WHO, and Professor Leo Yising, Senior Advisor at the Singapore National Center for Infectious Disease. Mr. Robin Natav, Community Lead for Climate and Health at the World Economic Forum, and Dr. R. Water, Deputy Director General of International Vaccine Institute. Please feel free to raise your question to the speakers and the panelists via the pigeonhole link you see on the screen later. And over to you, Dr. Lee.
Good afternoon, everyone. My name is Dr. Lee Fook Kay, and I'm the head of Pandemic Preparedness at the Temasek Foundation. I'll be your moderator today, but before we start the panel proper, do allow me to do certain things that will preface this panel, and for me to say a few words about Temasek Foundation's efforts in pandemic preparedness. Temasek Foundation has always believed in the importance of enhancing regional coordination, knowledge, innovation, and funding. One of the key ideas we are building on as we build up our pandemic preparedness programs is the idea of setting up an Asia Collaborative for disease research and control. In short, the Asia CDRC. So it's not the CDC that you know, it's a CDRC, and the C stands for collaborative. And basically, we're trying to bring together interested technical partners, strong co-funders to actually support regional efforts, which are typically very expensive, beyond the reach of one funder to do. So, and we need to do this because there is really a lack of cross-border collaboration. So while welcoming the audience into this discussion earlier, I met Tom from New York, and he mentioned that it's not preparedness, it's pandemic unpreparedness in Asia. And I fully agree with him, and I would just like to relate to what Paul's last slide tells us. Don't ever put the concept of pandemic preparedness in a museum and think that pandemic will not happen again. So there's lack of cross-border collaboration, there's lack of peacetime network cultivation, and lack of trusted and interoperable data material sharing platforms. This is very important because without data, we wouldn't know what we are going to be confronted with. And there's also a lack of knowledge in implementing innovations. So a lot of innovations are left in the lab. They couldn't cross the valley of death to be actually developed into products for implementation, and that's very sad. So that's where the role of philanthropy could come in. And it is our hope with a regional coordinated surveillance and response system and network, pandemic preparedness efforts can be harmonized and made more effective. I would also like to, at this point in time, introduce one of our sister entity who is in the Temasek Trust ecosystem. So as you know, Temasek Foundation is part of the Temasek Trust ecosystem. And one of our sister entities in the ecosystem is the Center for Impact Investing and Practices, which is a non-profit entity established to foster impact investing and practices in Asia and beyond by building and sharing knowledge, bringing together stakeholders in the community, and bringing about positive action that accelerates the adoption of impact investing. Noting the need to crowd in catalytic and commercial capital to address the funding gap in pandemic preparedness, the center has collaborated with the World Economic Forum, Giving to Amplify Earth Action, in short, Gaia initiative, and the Philanthropy Asia Alliance to deep dive into the issue of antimicrobial resistance in Asia. And why is antimicrobial resistance such an important thing that we need to do as part of our pandemic preparedness efforts? Because AMR, which is a short for antimicrobial resistance, is in fact a slow burn pandemic. And Asia is at the crux of this issue. As you know, we are responsible for, in Asia, there are, of all the deaths internationally related to AMR, Asia takes up about half of it. So the reason is that Asia is a fast-growing economic region in the world. I think a lot of attention are actually being paid towards the economic growth. Very little is actually being paid towards infrastructure development and building up a proper environment that will not nest the growth of AMR. So water pollution, as you know, heavy metals, the overuse of antibiotics in farming, all this contributes to AMR. And today, hence, I'm excited today to actually launch the report which is named Targeted Action and Financing the Fight Against Antimicrobial Resistance in Asia. This report draws insight from global disease burden data and stakeholders interview to illustrate the threat of AMR in our region. So tackling AMR is both a sprint and a marathon. You can probably have a copy of the report as you register when you come in, but if you don't have a copy of the report, you may want to scan the QR code here and you have an e-copy of it. You will be brought to the link to actually access the e-copy. And tackling AMR, as I mentioned earlier, entails a marathon, which is finding the right treatment for AMR, which takes a long time. So every time when you look at the development of a new drug, it takes a long time. But there are a few sprints that we can actually adopt to curb AMR. And that's actually looking at prevention, education, prevention, and monitoring. So the report does go into detail about all these measures in terms of how education should be done, how prevention and monitoring could help to attenuate the severity of AMR. So more investments, education in these areas, we hope that we can actually promote more support in terms of funding amongst the funders as well as private capital in this area. So AMR, like pandemic risk, is inextricably linked to climate change. Our colleagues in the World Economic Forum are working hard to drive urgent multi-stakeholder action in response to the risks of climate change and how the risks that climate change can pose on human health. And they do welcome your involvement in this. So you do see here the QR code to join this very important effort. So if you are interested, do scan the QR code to join. And if you have any questions that you want to ask further, we have a panelist here, Robin from WEF, who will be able to take your questions on that. So before I start, inviting our panelists to share their insights, I would like to invite you to ask questions wherever you are doubtful of anything or you want to clarify on any of the issues. Do send the questions through the pigeonhole, and I'll be monitoring it from there, and I may intersperse the questions into the discussions as well. So to start off this discussion, I would like to introduce Dr. Gina from the WHO. And Dr. Gina, can I ask you, what do you see as the top challenge in Asia in regard to pandemic preparedness? You have been working in the Western Pacific region, where most of the countries here are actually part of it. So what do you see as the biggest challenge to pandemic preparedness here?
Thank you, Dr. Fouquet. Let me start by telling you something that happened last year. The Philippines is one of the most disaster-prone, natural hazard-prone countries in our region and perhaps in the world, and is very well practiced in disaster management. Last year, they were hit by Typhoon Christine, and it hit the region. The country mobilized, as it always does, supplies, the logistics, the health workforce, the backup systems. But then they got hit by the next one in the same location. So they called in backup. They got resources, technical workforce capabilities from other regions of the Philippines. They were then hit in the same region by 4 more typhoons. So imagine 6 typhoons in a span of 2 months in the same region. The scale of that in terms of the workforce response, the health system's ability to mobilize supplies, hospital care, support for mental health, livelihoods. Where am I going with this? The risk profile of our region of Asia is changing. You wouldn't see this historically, that 6 typhoons in a span of 2 months and the country has to surge and to resurge and to keep going. So at some level, the biggest challenge we face now in terms of our risk is a changing risk profile, be it, as Paul presented, the One Health, the human-animal environment interface that's giving us new emerging diseases, be it respiratory diseases, be it mosquito-borne viruses. What can be next pandemic X is really important to think about and to prepare for, because the risks are growing, the hazard range is growing, the intensity, as I mentioned, of these typhoons, for example, in the Philippines, to experience these in such a big way, and our vulnerabilities are changing. So to your point about how Asia is fast changing, from 2000 to 2021, we went from 40% of the population in Asia living in urban environments to 63%. 7 in 10 deaths are related to NCDs. Younger populations are having preventable NCDs, which talks to our environment and our lifestyles. We have half our countries by 2030 being classified as aged populations. Why is that important? All that fast changing pace. It means that our vulnerabilities are changing, our at-risk populations are changing. And so all of this means it's a challenge for pandemic preparedness, because our planning, our preparedness needs to be flexible, agile, and adaptable to the changing world that we as a region live in.
And I would like to, Gina, I will have some of the questions for you later, but I would like Professor Liu Yisin. Professor Liu is a very experienced person in pandemics. He has led Singapore over 2 pandemics, SARS 2003, and then COVID in 2019, late part of 2019. So, Professor Liu, can I ask, do you have that same feeling as Gina in terms of, Singapore and also the surrounding regions here, that more could be done to actually enhance the pandemic preparedness? Yeah.
I think the answer is actually quite obvious. It's going to be a big yes. But I just want to build on the point that you mentioned earlier on about what is called a slow or hidden or silenced pandemic, which is the AMR, versus what really hit us hard, which is the overt kind of things like COVID-19 or even SARS 2003. And in these regions, we talk a lot about dengue. And dengue is really coming back and becoming a new disease in many areas that never had dengue before. So the questions always in my mind is that, can we handle the issues today that will help you to handle the issues tomorrow? And tomorrow may come, which is a big one, the pandemic. So my answer here is that we have not even prepared to even tackle the chronic issues that we see day to day, which is the AMR issues, which is our region's dengue issues. I think a lot of lessons need to be reflected in terms of how can we be able to pick up all these difficulties and challenges and how to work on it. So just coming back to Paul's presentations earlier on, I think the research is really moving very fast. There are a lot of new tools, but how can this tool be eventually being used on the ground and be able to implement and be able to scale up, I think is one of the greatest challenge. Then I've been asking myself, there is a lot of documents being pushed out by the WHO. We have the PRED, and we have what's the other one? The HIPAA. There's quite a lot of all these documents being produced by WHO that give you this global architecture building, that give you this guideline in terms of national buildings of the capacity. I think it's good to bring all this back and reflect and ask ourselves these critical questions. Out of these very good documentations, and we fail to deliver it, what exactly are the issues? It could be data sharing. We talk about data sharing. And just coming back to data sharing, it is not just sharing of data of that particular items that you're working on. Because I realize a lot of times lab can produce very good genomic data, but we need to interpret the genomic data and correlate it with clinical data. I've been asked many times, when you have a variant, what exactly is the clinical impact? How severe the disease is going to be? And there's always this lag phase in the clinical data. So I think we have to look broader than that, and first of all, admit that with all these diseases, it's not just solely a health issue. It is more than that, One Health and many things have to bring in. I would certainly hope that today's and all these forums that we have can bring all of us together, not just policy decisions maker, but people on the ground, people in the community, people with the money that can help some of the things to be done. That's my hope. Thank you.
Thank you so much. Together with Dr. Gina, Professor Liu, can I just ask a question more from the layman's perspective? So I have to put myself as a lay person in the public. When the pandemic first started, so I look at COVID-19, we all do not know how infectious it was, and some people are still imagining that, it's not that infectious. And, you could maybe just stay a bit further away from the person, but then later the information that came across to us that it is very infectious, even when very transient contact, you can actually get infected by, that kind of, this disease. So, what are the things that you would put in place to ensure this kind of education for the ordinary person in the public, so that, whenever there is a crisis that is looming, this kind of information could be disseminated, well to the public. Yeah. So, Dr. Gina, maybe.
Thank you. It's a great question, and I think it's a key issue that we face in the region. There's this concept of infodemic management, which is the overabundance of information, be it actually good information, misinformation, or those who are putting out disinformation. And so the public, as you say, is being bombarded by this infodemic. What do we do? And I have to tell you, countries reach out to WHO and ask for support to strengthen their ability to monitor for misinformation, disinformation. We actually can't keep up with the demand for this type of technical assistance because it's about setting in real time social behavioral insight monitoring, but also to think about it in the longer term. And so all of this needs systems that are quite adaptable to the needs to analyze, to collect data, to analyze the data, and then to take action on it. And it crosses that pathway of researchers, social scientists, to policymakers, to communicators. And what I think is a real advantage we have at our disposal in Asia is that our trust, the public's trust in government, is actually relatively higher than other regions of the world. And this is something that we can really leverage to keep going and strengthen public's trust and knowledge, awareness at a time when it will be important.
Thank you. Your views, Professor Liu?
Yeah, thanks, Fouquet. And I think, if I can read your mind, I think you are trying to look or, geared towards whole of society response. I think it is really a buzzword today, whole of government and whole of society approach. In other words, we know, I like this phrase that, outbreak or pandemic begins in the community and ends in the community. Basically, it is the community. So I think it is very important to have this concept of whole of society approach, where it is not stopping at just Ministry of Health. It is more than that. You have to have the whole of the governments working together and be able to engage the whole community. And that is not going to be overnight work. It has to be year-long and continuous work that we need to engage the community. And it'll be very good to develop this kind of communication platform. So you communicate with them constantly, truthful information you can give, and the kind of trust can be built over a long period of time.
Right. Thank you so much. At this point in time, there's a question, interesting question came from the audience, and I tried to flash it on the screen, but somehow this device is not working so well. So I shall read out the questions. And the question said that, what alternatives are there to increasing spending on pattern genomics for surveillance? So pattern genomics, as Paul has mentioned earlier, is the key. And Professor Liu mentioned that good interpretation of pattern genomics is important because, okay, so what? You have this variant. Is it going to be worse or is it going to be less severe? So what are we forfeiting in this over other approaches? So that's why I asked this question. So what do you think are other approaches to pattern genomics? Maybe I would, at this stage, like Paul, somebody can pass the mic to Paul, right, to explain. Paul, maybe you want to explain to the audience, why is pattern genomics so important, right, as a form of information?
I think it's the only thing that will tell you the detailed information about how samples are linked. And it only works when it's put on top of a well-functioning surveillance system. What a surveillance system is, it means somebody to realize this child here with a fever and a rash, maybe that's measles, right? That's the starting point. Then they send a blood sample away. Then they do a measles test. And then they say, that test is negative. We don't know what it is. Then it goes for genomics, right? So it's kind of like the last stage. The way I think about it, actually, is similar to back in the old days, I used to do work in HIV in Africa, yeah? And at that time, we didn't have a test. HIV was something that you'd have to manage in complicated tertiary hospitals with fancy tests, and you had no idea what was happening in your community. And what changed everything was the availability of a rapid HIV test, right? So you could test him and test her, and you all of a sudden know how many people have HIV in your community. When you're getting a test done, you say, that's really great that I'm negative, I'm gonna watch my behavior. And for those that are positive, you can get them into care. So by having access to a test, it really triggered many different entry points in the system from a prevention and care standpoint. And for me, genomics, it's the same thing. It's like a symbolic test that you can use for all pathogens at once. And it's all about, as Prof. Leo was saying, not just having the technology, but having the systems to implement it. And that includes working with manufacturers to bring costs down, improving supply chains, helping governments with planning and budgeting and guidance and policy making, as well as training health workers in terms of how to use it. So all of those things are important. So it's not just genomics, but I think it's a really good proxy for how well that whole system is working, and it provides us with information and insights that no other technology can provide.
Thank you, Paul. So at this stage, I would also like to, maybe my layman's understanding of, the genomic, patogenomics information, been very critical to actually look at the development of vaccines and the development of antivirals and therapeutics. So with us on stage, we have Dr. Ann Wattel from the International Vaccine Institute. And Ann you may want to explain to us what is the role of IVI and how is IVI, sort of addressing vaccine preparedness in the world, and especially Asia, because I think most of the vaccines are developed not so much in Asia. Though we say that yesterday, I think Bill Gates mentioned that some vaccines developed in Asia and like Indonesia and India is cheaper. So do you see Asia being a good place for this kind of vaccine development, so that to protect us from future pandemics?
Sure. So, first of all, the International Vaccine Institute is a not-for-profit international organization headquartered in Korea, South Korea. We now have 2 offices beyond Asia, one in Europe, in Sweden, for the region, European region, and we also have another regional office now in Africa to support vaccine development. So our mission is very simple. We discover, develop, and deliver safe, efficacious, and affordable vaccines for global health. And our focus is really to support LMICs, low and middle income countries. So for Asia, I have to say that there are key challenges and limitations when it comes to vaccine production that could hinder Asia pandemic preparedness. And these include, first of all, limited local manufacturing capacity. Global vaccine manufacturing is heavily concentrated outside of the Asia-Pacific region, despite it being home for 60% of the world population. There are key producers, as mentioned by Bill Gates, like China, India, Japan, and Indonesia. They do exist in the region, but the overall regional capacity is insufficient to meet the local vaccine needs. Thus, many Asian countries actually, especially low and middle income countries, lack sufficient domestic vaccine production capabilities. This increases reliance on global suppliers, which can be problematic for supply chains when there are strains during the global crisis. The second point in Asia is the technology infrastructure gaps. And we know that high-tech platforms like mRNA platform production required advanced manufacturing and expertise, and which are not yet widespread in Asia. The WHO mRNA Hub in Indonesia is a great initiative, actually, to support this mRNA innovation in the region. But upgrading facilities and training personnel takes time. We need to invest into manpower training as well. Number 3, the supply chain. vulnerability. That's another issue that Asia can face. And vaccine production depends actually on the complex global supply chain for raw materials, for instance, and disruptions can significantly slow vaccine availability due to geopolitical tensions, due to export restrictions, or due to logistical delays. And the number 4 challenge is the regulatory hurdles and harmonizations. And we know in Asia there are very robust regulatory bodies, such as HSA in Singapore, or Korea FDA in Korea. They're very robust regulatory body, but differing national regulatory requirements can also delay regional vaccine approval and distribution, as we know that. So lack of harmonization also limits collaborative efforts and mutual recognitions of vaccines. That's another challenge that Asia is facing. And enhancing regulatory frameworks through systematic gap analysis or through capacity building and professional training is critical for accelerating vaccine approval and distribution. And the number 5 issue is the funding. Funding and investment constraints. Many countries really struggle with sustained financing for vaccine R&D and manufacturing. Emergency funding is often, in the past, reactive rather than proactive, which hampers long-term preparedness as well. For COVID-19, various funds have been established, including the Pandemic Fund, to support various capacity building and strengthening programs. And I just want to elaborate a bit on the Pandemic Fund. The Pandemic Fund is actually a global initiative established in 2022 by the World Bank and in collaboration with WHO, actually, and other partners. The purpose of this Pandemic Fund is to strengthen global pandemic prevention, preparedness and response capabilities in LMSs. So the primary role of the Pandemic Fund is to reduce the global vulnerability to pandemic through different initiatives. First, building and strengthening capacity for disease surveillance, lab systems, and also emergency response. Number 2 is to create more resilient health systems in the region, for instance, that can withstand pandemic threats. Number 3, the Pandemic Fund is also aimed at addressing critical gaps in pandemic preparedness infrastructure, particularly in resource-limited settings. And number 4, this Pandemic Fund is aimed at facilitating international cooperation and collaboration for pandemic response. So their scope of work is very comprehensive, including early detection and surveillance system, and also lab capacity and diagnostics. Number 3 is to support emergency response operations and also to train the workforce to be ready to tackle the next pandemic in addition to engaging with community. So there are initiatives that Asia can really tap into to get more prepared.
I would take on 2 of your points on funding, as well as setting up of structures, within countries to actually develop further on this kind of pandemic preparedness capabilities like vaccine development. You mentioned about lab capabilities and things like that. But before I go into that question, again, there are a lot of questions related to funding, and especially in the area of AMR. So, what is the biggest funding gap? One of the questions here asked in relation to AMR. So I would like to pass over to Robin from WEF, and Robin actually is, leading the Davos Compact program. So, Robin, can you explain to us, is funding the only sort of like measure that you would put in to actually curb AMR, and is there really a lack of funding gap for AMR?
Thanks, Fouquet. So I will say I lead WEF's climate and health community and work, and we have colleagues who are experts on AMR who weren't able to join us today in Singapore. So I'll try my best to answer questions, but I'm not an AMR specialist, unfortunately. I think funding is a reflection of interest and kind of multi-stakeholder efforts to address these challenges. And at WEF, we're the International Organization for Public-Private Cooperation, so we tend to work on many challenges like AMR, like the effects of climate change on health, which are complex, intertwined, multifaceted, which require cooperation and solutions from across many different levels. Wicked problems is often a way some of these are referred to. So obviously, one example in our heat resilience work is, healthcare industry and healthcare philanthropy have been at the forefront, but we also engage with construction, we also engage with food and agriculture, we engage with insurance, we engage with governments, as well as business and philanthropy, who have to set priorities and set policies. And all of this has to be coordinated across the global, national, and sometimes hyperlocal level, like when disasters hit, as Dr. Gina was talking about. And we know that bringing all these stakeholders together across silos, across types of organizations, is really tricky. We've done research on specifically climate and health, and why investment in climate and health is challenging and insufficient. And this won't be a surprise to anyone working in climate, or anyone working in health, or anyone working on any of these big global challenges, but unclear market demand was a key issue. Fragmented policies was another key issue. Sectoral silos and even lack of a common vocabulary was a key issue. So these are challenges that I think we need to learn to overcome for AMR, for pandemic preparedness, and generally to protect us from climate change. The good news is we have examples of where these have been overcome, and we know that public-private philanthropic action can be done. Gavi was an example that was discussed at length yesterday around vaccine access, where countries and philanthropies came together to aggregate market demand and then negotiate with pharmaceutical producers a tiered pricing structure, which would not have been possible, right, without coming together. Similarly, on AMR, we've got initiatives like CARB-X or the AMR Action Fund, which bring multilateral funders, government funders, philanthropic funders, and private investors together to enable the discovery of new antibiotics. So I think, the question is, where do we go from there, and how do we build on this? And on AMR, you were very generous in kind of inviting everyone here to join the Davos Compact, which is a response to the high-level meeting that took place in New York in September. But we also have an initiative called UCares, which is all about kind of how the private sector can support government leadership in this space, what it can bring to the table, resources, yes, but also expertise, and also kind of innovation capacity, and also production capacities. On climate and health, we're open to developing similar models, and we're thinking that the national level, given how different the impact of climate change on health will be in different countries, is a good place to start. And so I'd like to also invite anyone here who's interested in helping us develop and grow these country activators to also contribute to our work. We think Southeast Asia could be a great place to start, because we have government leadership, we have philanthropic leadership, we have a good understanding of how climate change will affect health, and we have, of course, strong interest from a lot of our private sector partners at the World Economic Forum.
Thank you very much. Robin, I understand that you used to work in Wellcome Trust. So there is a question that comes in. Perhaps you can use your experience in Wellcome Trust and also your current experience in WEF to actually explain how can how can private funders who actually kindly donated these funds are confident that it has reached probable ground. The money has really been used, for what they have donated it for. So maybe you want to explain a bit about this funding network. Yeah.
I will try my best, but of course I can't speak on behalf of Wellcome Trust. My colleague Alan is here and much better placed to answer the question on behalf of Wellcome if that's what you're after. But I think, how do we know that funds are effective? We design trusting relationships between institutions, we set common goals, and we align on these, and hopefully these are set by governments who kind of provide the signal and provide the monitoring framework. A lot of these challenges require learning. It's not like, when we design funds and initiatives on some of these emerging challenges, we don't exactly know what needs to be done and what is going to work and what is not going to work where. And so having built-in mechanisms through these funds and these initiatives to learn, to see what is working with kind of direct monitoring, and to adapt approaches that are being designed to different geographies, to different communities, is really important. We know that science is essential, and grounding in evidence is essential, but we also know that communities and behavioral change are key aspects of these challenges. And, you know, unfortunately, science does not speak for itself and does not kind of automatically translate into action. So a lot of it is around the art more than the science of getting communities and getting people to change their behaviors, their actions, their preferences. And that is an iterative process, I think, and we need to recognize that when we build funding approaches.
Great, right. So coming back on about the Pandemic Preparedness Fund, right, in terms of implementation, what do you see as the sort of like, you know, a trusted way of engaging funders to contribute to the pandemic preparedness funds? How would you then implement this kind of funding mechanism?
Well, I think one of the models that could help, you know, this pandemic fund is the public-private partnership. And we know actually that the public-private partnership models plays a critical role in vaccine production and pandemic preparedness as well, and disease prevention. By bridging, you know, the strength of governments, funders, international organizations, academia, and private sector to accelerate, you know, product development, and in a way to accelerate innovation and expand manufacturing capacity. So there are organizations, you know, on the ground, being implementing partners that could really play a key role, you know, interacting with different stakeholders, including funders, including private sector and research institute to implement, you know, new tools, innovations on the ground. So I really encourage and I hope that this public-private partnership model can still play a role in that.
That's great. So now I would like to come back to Dr. Gina and also Professor Liu. Right, in terms of building up the infrastructure in Asia to actually take on this kind of pandemic preparedness programs. Do you see Asia as lacking, you know, in infrastructure, or do you see that there's a very inconsistent spread of capabilities across Asia? And how do you also, you know, look towards like building that consistency, that standardization of capabilities across Asia? Gina, you want to start first?
Sure, thank you, Fouquet. I think we have an opportunity to turn diversity in Asia into an operational strength. I do think there's more that we can do in this space. Let's take the example of the countries in Europe, where they established, during the course of the COVID-19 pandemic, the Health Emergency Response Agency called HERA. And they looked and thought, where are some of our preparedness gaps, where the unit of measure isn't individual countries, but the region. And why the region? Because that collective power brings with it innovation from across their networks. It brings in resourcing, bargaining power, and basically an incredible intensity of capacity. And by doing that, they can look at end-to-end issues to improve their preparedness. And I think this is really a good model, because what we're seeing now is they are investing in global genomic surveillance to advance their regional preparedness. They're investing in partnerships on research innovation wide and across the globe. They're investing in manufacturing. They're investing in advanced purchase agreements to secure products for the time of an emergency. They're thinking about pandemic planning in a coherent way. They're looking at federated data models so that information is exchanged in an appropriate, timely fashion. So all of that, if the unit of measure is the region and not a single country, you can pool and you have this collective ability to do more. So I think that operational readiness, we can take all the strengths of the region and the countries in the region and put it to a greater collective asset.
That's a very encouraging answer. I think each one has their own strengths and we can write on that. So then brings us to a very important aspect of pandemic preparedness, which is One Health. And One Health, as you know, is looking at the environment, looking at the, the zoonotic side of the house, and see how they could actually be sort of like optimized over the human part as well. So, Professor Liu, I would like you to comment a bit on the importance of One Health in pandemic preparedness, because I think that's something that's very relevant to Asia, because there seems to be an inadvertent negligence of environment and also a closeness to animals where risks of animal diseases are not really, precautions are not taken, right, to actually prevent zoonotic transmissions and so on. So do you want to say about the One Health part of it? Yeah.
Well, maybe I come back to the most recent INB, the pandemic treaty. There are a lot of comments about the INB pandemic treaty. Finally, we managed to have all the member states coming together to produce a document that is legally binding. It may not be perfect, but it just shows that there's the desire for all the member states to come together, because all of us fully aware of the potential imminent danger of the potential next big one that's going to come, right? Then if you look at the pandemic treaty, the One Health survive is there. So it just means that we recognize the importance of One Health as part of the pandemic preparedness. I think that is something very important. Now, the questions about, is Asia prepared? Can we do better? I would say that there's still big room for us to improve. I would say that Asia is actually quite big. Even if you break it down into very smaller geographical area, we are still very different. Heterogeneous is really what we are seeing even in Southeast Asia. So in order to bring very heterogeneous group together to work on something that is common, it requires a lot of communication, discussions, and coming together and bring people together. So I think it is something that I wish that it will happen, where we can bring people together, be able to, in a transparent way, bring out the issues, and whether that issues is a problem statements to find a solutions. And I think certainly I hope that the philanthropies in this group will be able to give this support for this kind of initiation. In other words, we need to communicate, we need to come together, we need to trash out the issues, we need to find the solutions that is relevant to us in our regions. So I think Africa CDC is one of the shining examples. The 50 over member states able to come together to form a combined effort to look into pandemic preparedness and many other issues, and also the recently launched epidemic fund, Africa CDC Epidemic Fund, to give a rapid response and fund flexible funds for mobilizations, resource mobilizations. I think there are a lot of good examples there for Asia, Southeast Asia to look at, and I hope that this day will come and it will come soon.
Right. So the next question I would like to pose to Anne is on the prophylactic part, which is the vaccines again. So Anne, do you now see that mRNA is the most flexible vaccine backbone that we could harness on? And do you see more efforts should be put on the mRNA side, or we should divest to look at other flexible kind of vaccine backbones that we can rely on to quickly swing to develop a vaccine very quickly in the dawn of a pandemic? Yeah.
Thank you for the question. This is a tricky one, but clearly the mRNA platform has been a scientific breakthrough during COVID-19, right? We have seen we can get the vaccine less than a year, which is a scientific breakthrough. We have never seen that in the past, right? Usually we say 10 to 20 years to get a novel vaccine, reaching the market. So mRNA vaccine has shown its merits, but I would say that we should carry on with additional platforms, characterizations, because there are different pathogens out there. You have parasitic, you have viruses, you have bacteria out there. So I don't think that mRNA can tackle all diseases. We need to still spend some time, to look into other platform of technology, not relying only on mRNA platform, I would say.
I see.
And there are, different groups working on different, platforms as well, and we should have funding, for those groups to invest into alternative platforms.
Right. So again, coming back to One Health, right? So One Health has a tremendous significance for vaccine development as well, right? Because you look at the zoonotic diseases, so you may want to sort of like prepare that kind of vaccination programs, for in the light of what is active in animal reservoirs. So for the AMR part, in terms of One Health, I think there's a lot of relevance about One Health to AMR. So I would like to ask Robin, right, from the Davos Compact point of view, do you see a One Health agenda in AMR?
I think, of course, AMR is one of these wicked challenges that cuts across sectors, and of course there's a One Health dimension to the challenge because of the risk of mutations happening in animals then infecting humans, and so yes, and also the resistance that is being spread through agriculture, through livestock production, is also a major risk. So, of course, I was talking about the need for behavior change. Addressing AMR risk is not just about developing new antibiotics and developing new drugs. Of course, these are essential, and luckily we're in a better place than we were a few years ago on that. But if we spray some of these, special antibiotics or antifungals that are supposed to be for use of last resort on vegetables to protect them from fungal infections, which is unfortunately what's happening in a lot of countries still, then we lose that antibiotic of last resort that has taken years to develop. And so we can't address AMR risks without an integrated approach that looks at livestock, that looks at agriculture, that looks at fisheries, as well as kind of the health angle.
Right. And we have always been looking at diseases, and we tend to be less worried about diseases which has an antiviral treatment. So like flu, right? I think now flu, people has sort of like look at flu a little differently. They're more reassured of treatment for flu because most of the antivirals are still effective. But one of our friends who was supposed to attend this forum today from Vietnam just emailed me yesterday and said he couldn't come because there's an atypical case of influenza in Vietnam that seems to be not effective, cannot be effectively treated by oseltamivir, which is the traditional antiviral for flu. Professor Liu, do you see antiviral kind of capability as something that is like a silver bullet in the longer term for the fight against pandemic? Because it's something that is so easily deployed, right? I mean, as a medical doctor, you can just administer even if the person is infected, yeah.
I'm an infectious disease clinician, and I always respect microbes because they have the capacity to mutate or rather, evolve in a way much faster than human. It takes us 20, 30 years to have one generation. It takes them so much shorter times for one generation to another generation. They have this huge capacity in terms of evolutions and genetic changes. So I have a lot of respect to the microbe. And same goes for bacteria and virus. If you think penicillins, vaccines, discovery, that is the end game for the humans against infectious disease, then you see today it is not the case. So I think we really need to think hard in terms of playing around with the microbes because they will change. And if one day, should the genetic changes in the new form of influenza virus, there is resistance to the available antivirus, then we'll be back to square one. And we can never promise that this day will never come. So I think it is important for us to always keep pace. And I always believe in myself when you confront with a pandemic, always try to be ahead of the curve. Try to be faster than the virus. And sometimes we fail because the virus may be ahead of us, but then you have to pace up and increase your pace to be able to overcome it. So I think it is never end game, I would say. We just have to continuously monitor with good surveillance system, with data sharing, understand the situations, and be able to respond as quickly as possible.
Right. So I think we have come to a part where we need to take stock of the time to respect the timing given for this particular forum. I would like to open up to the floor. Are there any distinguished guests here who has filed the question and have not been able to group them into a group questions to be posed to the panel? Do raise it. Okay, looks like we have a lot to do in pandemic preparedness, and harmonizing efforts in pandemic preparedness is a difficult thing to do, right? Oh, we have a question, yes. Please.
Hi everyone, I'm Wilnert. I'm from National Center for Infectious Disease, and like Prof. Leo, she's my boss. I'm an infectious disease doctor as well. My question is really regarding the possibility of investing in human behaviors, building on what Robin was mentioning earlier. Because if we were to think about it, what I do is I give patients vaccines, right? Trying to encourage them in travel clinic to take vaccines to prevent infections. But it's very much like an insurance in that sense. People will say they don't want to take vaccines because they've got optimism bias. And so similarly for pandemic preparedness, for AMR, oftentimes the last man on the ground, the person who is a farmer who is dealing with problems with making ends meet, they will not be thinking about pandemic preparedness. So how can funders or maybe physicians or anybody in this ecosystem help the last man on the ground believe in this pandemic preparedness? Can we invest in that? Thank you.
I think it's an excellent question because I think you need to really go to the whole of community approach. You need to understand what is the ground issues. If the farmer is not going to report to you about their flock, their dying of whatever conditions, you'll never get the information, right? So I think I don't have the solutions, but it's a real good challenging questions and a lot of suggestions about incentive and other measures. But I think we really truly need to actively look into this.
Yeah, I agree. I wish I had the answer because, then I could probably be much more useful to solve some of these problems in the world. But I think it's about engagement. I mean, if there's one thing that I've learned through some of the work that I do is people only take responsibility if they feel responsible and empowered. And so I think it's taking on a lot to say that it's the job of infectious disease specialists or medical practitioners to get farmers to care. I think it's the job of a whole society. It's the job of our governments, and it's the job of our media. And it's, until we take collective ownership for some of these challenges, we're not going to have collective responsibility for addressing them. COVID has been helpful, right, in that respect, because everybody's seen the risk. But as you say, optimism bias, and people want to move on, right? So it's a challenge.
I think we all have a lot to do, both from the funder side as well as from the implementer side. A lot to do for harmonizing efforts in pandemic preparedness. But I think we need to start somewhere. And what the panel has shared with you are very good areas that we can start, whether it's in terms of building up capability, looking at sharing of data, and then pulling in together networks that can actually help each other to actually promote regional preparedness. I think that's where we start. And I think for people who are interested to know more about some of our local programs that Temasek Foundation has funded, you're most welcome to actually go into our website, as well as also contact myself and my colleagues, Dr. Singman Jie here, to understand some of our pandemic funding efforts that we have put in place. We can't be doing everything, so we're trying to put in as many contributors as possible to the effort. And we know that is a big thing to do, but we have to start somewhere. Otherwise, it will never be realized in terms of the harmonization of pandemic preparedness efforts. So it leaves me last but to thank our very good panelists here who have taken up so much of their time this afternoon to share their expert views with us. So I would like to thank Dr. Gina. Thank you so much, Gina. You have been so fantastic. And Professor Liu, I always respect all your opinions. And your contribution, your ideas on vaccines are fantastic. And Robin, yeah, you have great in terms of the co-funding part of it.
Thank you, Fouquet.
Thank you.
Thanks, everyone.
Thank you, everyone.